start by warming up the fascia on both sides of the low back. And so we're going to take our dominant hand and put it down first, thumb on one side, fingers on the other, nice, broad, don't crunch them up, nice, broad, flat. Come over and brace, finger on finger, thumb on top of thumb. Get in a lunge stance, and then just back and forth, just warming up the tissue. Notice how I'm using my body, and when I lean into her, I'm pushing with thumb, pushing with fingers, and as I come back, I'm dragging, pushing, dragging, pushing, dragging. Can't really contact quadratus lumborum, but you're working through the thoracolumbar fascia, lumbodorsal fascia, and really kind of getting some of that tissue that may be restraining nerve mobilization, nerve movement through there. So we warm it up like that for a little while, and then we go to a technique that I really like for iliolumbar ligaments. Recall that iliolumbar ligaments in women go from L4, L5 to the ilium, and in men, primarily L5 to the ilium. So why are we doing iliolumbar ligament techniques? Because the iliolumbar ligaments have hoods that lie on top of the sciatic nerve. So we're going to get in here with a flying V, Dalton flying V. So we're going to be bracing like that, index finger on middle finger on index finger. We're going to come in on either side as close to the spine as possible, right at L5S1, right? L4, L5, L5S1. You can really get in there actually to L5S1 this way. Otherwise, you can't really contact the transverse processes of L5 with like an elbow or anything. You have to get in between the ilium because they're tucked way up in under there. Many people think they're affecting L5 and they're not. So here's what I do. Notice the jerky motion. My whole body kind of contracts in there, and I get into a motion that I'm letting Dina recoil against me so that it's this, along with sound effects. Then I sweep down again. I sweep down. That feels good. They like it. You'll get real strong. When you're doing these techniques, be sure and keep your forearm extensors firm. That's a big mistake I see in workshops all the time. Our extensors are always going to be weaker than our flexors, and you can't get good pressure if you have a weak link coming through these extensor muscles. When you're doing extended finger work, your extensor muscles are what you need to be focusing on, not your fingers, not your shoulders, because this will be the weak link. You'll have to compensate on further up the chain. So I'm thinking firming up my extensor muscles. Look at how it comes through my whole body when I do that. Okay? So you get up in there and then you do a little sacral base decompression. You guys have seen me do this. You get in here with the left hand bracing the lumbars, right hand on the sacrum. We're basically thinking L5S1, L4, L5, just separating those lumbars, getting some juice in there. Hydrate, hydrate, hydrate.